Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, members of the Interagency Task Force are tasked to oversee local government units under MECQ as part of the government's COVID-19 response. But what exactly will be their roles? Some lawmakers are pushing for the extension of the modified community quarantine in Metro Manila, but Malacañang stands firm that an extension is unlikely. And amid health anxieties and other concerns, should the Education Department push through the opening of classes on August 24, Interagency Task Force on Emerging Infectious Diseases Co-Chairman and Cabinet Secretary Karlo Nograles joins us live. Malacañang says that cabinet members assigned to monitor areas under modified enhanced community quarantine will act as big brothers and sisters to support local governments in their coronavirus efforts. The new step by the COVID-19 Interagency Task Force comes as Metro Manila and 4 provinces await the decision if the MECQ status will be extended, lifted, or changed. Coronavirus cases in the country has reached 147,000 as of Thursday. Most of the new cases have been recorded in Metro Manila, Laguna, Cebu, Rizal, and Cavite. Let's go straight to the source of the story. We have COVID-19 Interagency Task Force Co-Chair and Cabinet Secretary Karlo Nograles. Secretary Nograles, welcome to the source and thank you for your time.
Thanks for inviting, Pinky. Magandang umaga po sa lahat ng nanonood ngayon. Good morning.
UP prediction is that we will reach 150,000 by the end of August. It's August 14 and we're now at 147,000. Would you say that government is still on the right track in addressing this pandemic?
I think may mga challenges po tayo. And we have to take it one challenge at a time. So right now, nakikita natin na most of the cases are coming from NCR and neighboring provinces of NCR. And then itong ginawa natin na MECQ, we will feel the positive effects of this in the coming weeks pa, no? Because of the incubation period of the virus. So makikita natin magsa-slow down ang number of COVID-19 positive cases per day. You will see a slowdown in that in the next few weeks. And right now, because nag-assign na nga po tayo ng mga cabinet members per city of Metro Manila and the neighboring provinces of Bulacan, Cavite, Laguna, and Rizal, we can expect more coordinated efforts between the LGUs and the national government agencies. So kami ng mga cabinet members who are overseeing the different LGUs, kami yung parang tulay nila papunta sa mga national government agencies and vice versa. So kung may kailangan na mga interventions ang local government units based on the assessments of our national government agencies or the national IATF, then mas madali na lang yung coordination na mangyayari at mas mabilis ang actions na mangyayari sa ground, which is led by the LGUs.
And you said that yung ginawa nating MECQ, yung effects nito will be realized in the next couple of weeks. But on August, I believe 18, supposed to be matatapos na or i-change yung status po natin. Does it mean, Secretary Nograles, that if we're going to see the fruits of this MECQ in the next couple of weeks, do you suggest that the MECQ then be extended?
Well, we did a preliminary assessment or a first pass, in the last IATF meeting, and we've tasked someone from the IATF to speak confidentially with the different mayors of NCR and the neighboring provinces to tell them na ito yung assessment namin sa first pass and to give them the chance to submit an appeal if they wish to. And then today, sa IATF meeting namin this afternoon, we will be looking at the appeals, if any, of the different Metro Manila and neighboring provinces, LGUs. Then we will give a final recommendation to the President kasi ultimately si Pangulo naman ang magdedesisyon kung i-retain ba natin ang MECQ
Absolutely.
or we go to GCQ. But whatever the
So ibig sabihin,
whatever decision will
that means
be.
Sorry, Secretary, because you said first pass. Are you implying that meron na po kayong so far decision at pina-disseminate nyo na po ito sa mga mayors and you are giving the mayors the chance to appeal whatever this first pass decision is?
Yes, that's the protocol ever since. No, so meron first pass, and then we give it in advance to the mayors, and then we will look at any appeal if may mag-appeal ng mga mayor or governor. Today, that's our second pass, together with looking at the current numbers, and then after that, we will make a recommendation to the president, and ultimately si Pangulo ang magdedesisyon kung ano ang magiging next category or kung anong magbabago ba yung category ng Metro Manila and the neighboring provinces.
And what is the recommendation on the first pass?
It's sent confidentially kasi to the to the mayors for them to make the appeal. So that kasi hindi pa naman siya final, no? It's a preliminary assessment. So we don't really divulge it to the public because that's between the IATF and the concerned LGUs. Kasi ayaw rin namin
but let's
pangunahan
look
yung
at the
desisyon ni
factors
Pangulo.
right now, Secretary. Yeah, that has been the case naman po talaga. All right, so let's look at the factors. We are at 147,000 mid-August. Sabi ng UP, ang prediction 150 by end of August. In other words, naabot po natin yan. Meron pang 2 weeks to go. Number 2, of course, we need to talk about the critical care capacity. Number 3, we also need to talk about the contact tracing, which seems to be a problem. Mayor Benji Bagalo, ang the contact tracing czar, is saying that kulang pa tayo and some of the LGUs need to siguro step up. Dahil nga daw they became too busy with pamimigay ng ayuda, building up siguro yung mga testing facilities nila and taking care of their kababayans. With all those factors coming into play, personally kayo, are you optimistic that an MECQ extension is the way forward for another 2 weeks?
We can do it either way naman anywhere, whether we retain the MECQ or we go GCQ, it can be managed, especially right now na meron na pong Cabinet Secretary who is coordinating with the LGUs. So per Cabinet Secretary, we're gonna do a deep dive into the numbers and the situation per locality. And we can always do naman under the National Action Plan Phase 2, localized lockdowns. So there is also some wisdom naman in going less restrictive, category. But as long as i-impose natin yung mga localized lockdowns, especially kung saan nagkakaroon ng mga clustering of cases. So it could be either way, no? At the end of the day, si Pangulo magde-decide, but we'll present him with the options, no? The MECQ is, of course, the entire Metro Manila, but there will be barangays that are not as badly affected as others, no? So pwede rin mag-GCQ, but kung maglo-localized lockdown tayo sa mga barangays or puroks or streets where there's clustering or there is heavy infection ng COVID-19, then that's really the deep down, granular, localized model that is found in our National Action Plan Phase 2. Dapat gano'n naman talaga ang direction natin. And it can be managed that way. And it can be a more efficient management, no, of the metropolis if we do the localized lockdown. As long as maganda at efficient at mabilis yung ating paglo-localize ng lockdowns.
But the localized lockdown is not new, Secretary. It's something that has been discussed in the past month or so. What would make it different this time around in the event that we move to a less lenient, rather a more lenient status compared to what we are now? Ano hong magiging siguro kakaiba this time around sakaling pumunta tayo sa GCQ at magkaroon ng localized lockdown?
Well, under this setup, meron na tayong macro and meron na tayong micro, no? So the micro would be in the LGUs, no? The LGUs being on the ground itself will be able to detect or see what communities need to have localized lockdowns or puroks or streets, no, based on their self-assessment as an LGU. Whereas yung macro, on the macro level, ang mga national government agencies and the national IATF represented by the different cabinet secretaries, iba naman yung aming view. It will be more on a bird's eye view, and we might be able to prod, no, the local government units to look at certain areas that they might not necessarily see. Because of the data, iba yung data na nakukuha ng isang locality, and then yung data rin na nakukuha ng national level. So with both the macro and the micro approach per LGU, then we would be seeing dapat more enhanced localized lockdowns and faster localized lockdowns at the LGU level, dahil pareho ng national government agencies through the cabinet secretaries and the LGUs are taking a look at each and every city in Metro Manila.
So that is the difference, a macro and a micro approach. And I guess because you will act as big brothers or big sisters. But before I leave this topic on the current status we have, would you be able to share to us your personal view at the moment, given the factors that we are faced right now? Is it smarter to stay in MECQ, or is it more likely that we will go to GCQ?
Again, we'll discuss it this afternoon sa big IATF meeting. We'll look at the numbers again. We'll look at any appeals if there were any submitted, no? And we'll submit our recommendations to the President. Ayoko rin pangunahan yung IATF at ang Presidente dun sa decision niyan.
We'll be taking a very short break. The Source will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, IATF co-chair Karlo Nograles. Secretary, let's talk about this big brother, big sister plan. Kanino ho nanggaling ito?
Pinag-usapan sa IATF kasi because of the experience that we had with Cebu City, no, wherein the President assigned Secretary Roy Simatu, member of the IATF, to act as kumbaga overseer, no, dun sa Cebu City. And because of the experience we've had, the success that we've had in Cebu City, much the same way, we want to be able to duplicate or replicate that here in Metro Manila. Metro Manila, different from Cebu City, syempre it's a metropolis of different cities. So what we wanted to do was, just like Cebu City, consider each and every city of Metro Manila as Cebu City, and then assign at least one cabinet member dun sa syudad na yan para to act as overseer, coordinator, enabler of the LGU, while the effort against COVID-19 will still be LGU-led. Nandito kami para to act as bridge and to help them as far as coordinating efforts with the national government agencies. Then from there, we also looked at the other MECQ provinces, which was Bulacan, Laguna, Cavite, and Rizal. Diba? So nag-appoint din kami, nag-assign din tayo ng cabinet secretary in charge for those provinces.
But who among the members of the IATF pushed for this setup now?
It was a consensus naman. So during the IATF meeting, pag-usapan na dahil nag-MECQ tayo, And ever since MECQ naman, we were looking at what to enhance, no? What mechanisms to put in place, what interventions to put in place that would make it different from business as usual. Obviously, we didn't want business as usual. We wanted to step up our efforts. So during the discussion, lumabas itong Cebu City as an example. And what worked in Cebu City.
Okay.
And yun. So napag-usapan, sige, mag-assign tayo ng mga cabinet secretaries to act as enablers.
You know, I asked that also because Senator Nancy Binay had a tweet, and basically what she said was, planong hindi daw masyadong napag-isipan, may kakayahan pa ba daw yung cabinet secretaries to gampanan itong bagong role nila na bilang enablers or, you know, a bridge between the local government and
actually
the IATF or the NTF for that matter.
It's a good plan because pagdating sa IATF, the members who are assigned per city naman are also IATF members. No? So when we go to the IATF meetings, we can bring our experiences also in terms of our coordination with our adopted LGUs. No? So nagkakaroon ng bagong perspektiba ang mga members ng IATF. So we're not only looking at it from a macro level, but on a more granular level at that, no? Because we now have personal coordination with specific LGUs. In the same manner, when we meet every IATF, we will also be bringing our experiences and the issues and concerns per LGU. So that way, since in the big IATF meeting, nandun naman ang cabinet secretaries, if we have a concern, say, kunyari ako, Quezon City, kung may mga concerns ang Quezon City, then I would act as bridge, no, to the IATF national in terms of the needs of the Quezon City government para mas speed up din yung mga pangangailangan nila. In the same manner, kung meron mga IATF resolutions, protocols, or mechanisms or interventions na decided sa big national IATF meeting, madali ko na rin i-cascade sa Quezon City. So that way, mas efficient din po, no? And it gives everybody a new perspective. And I think new perspectives are important, especially in this fight against COVID-19.
You do say this is a good idea, probably because there is better coordination between the local government officials, for example, the mayor and a cabinet secretary. Do you wish you had done this sooner?
Well, at that time siguro, before we made this decision, nakokontrol pa naman natin, no? And right now, we're just stepping up our efforts. And I guess with the number of cases rising, mas marami siguro yung mga concerns na kailangan bigyan ng mabilis na solusyon.
Okay.
So it's something that it's really a learning process for all countries and all governments for that matter. No? And we take it one step at a time and one challenge at a time.
You're assigned in Quezon City. Sa nakikita niyo po, what is the first order of business for you as the bridge enabler to assist Quezon City? Ano ho yung una niyo nang tututukan ngayon?
Actually, nag-preliminary meeting na po kami with the Quezon City administration. No? So I was endorsed by Mayor Joy Belmonte dun sa kanyang team, and we had an extensive discussion yesterday with her team, no? And we agreed on a 6-step approach for Quezon City, and this is guided also by the guidelines of the WHO. So our 6-step approach would be, number 1, we must control transmissions, local transmissions in the city. Number 2, increase the health system capacities, especially testing, tracing, isolation, and treatment. Number 3, we have to identify outbreaks in the city, in communities, in special settings, and minimize these outbreaks. Number 4, impose preventive measures in the workplaces and other essential places like transportation, no? For instance. Number 5, to manage importation, the importation risks. No? And when I say importation, meaning say from neighboring cities, those outside Quezon City going to Quezon City or passing through Quezon City. And number 6 is to get all the communities down to the barangay and purok levels fully engaged, informed, aware, and empowered. Now, all of these 6 steps naman, Quezon City has been doing and is doing, but we've committed to enhance it some more, especially right now with the coordination, better coordination with the national government agencies. So with the 6-step process, we've identified kung ano yung mga areas that we need to step up our efforts. And then I asked them what they needed from the national government. And then ganun yung naging communication namin with her team.
So knowing that they have that 6-step process already in place and you're coming in and speaking to them, sir, ano ho yung inyong focus ngayon looking into this 6 steps? What is the most important process that needs to be addressed in Quezon City right now with your help?
Yeah, ang napag-usapan namin is the reconciling of data, no, and to speed up the delivery of data from the national government to the local government. So, for instance, dapat mas mabilis at hiningi ng Quezon City yung mga pangalan ng mga pasyente na na-swab na kung sila ay taga Quezon City, yung mga na-swab at yung nagiging positive para madali agad silang mag-deploy ng kanilang contact tracers. So what we're trying to do is not just wait for the results ng swabbing, but immediately we'll try to work out a mechanism na pag-swab pa lang ng mga pasyente who are residents of Quezon City, na-alert na agad ang Quezon City kung sino yung mga residente nila na nagpa-swab. Number 2 is yung increasing the health capacities. No? Most of the beds of NCR are found in Quezon City. So the bulk of the hospital beds, isolation beds, ICU beds are found in Quezon City. And we want to push more of the private hospitals to increase the bed capacity by at least from 20 to 30%. No? Ipupush namin yan. And then for the public hospitals, both local hospitals and government hospitals in Quezon City, we want to push for a 30% to 40% to maybe 50% max allocation of beds for COVID patients para mas lumuwag po yung health capacity. Then of course, yung healthcare workers. Quezon City is now hiring more healthcare workers to man more of their isolation, treatment, and medical facilities and quarantine facilities. So similar to the national government na naghanap kami sa national government ng mga additional na ma-hire na health care workers, Quezon City is also on hiring spree. So if there's anybody who's listening there na mga healthcare workers, if you're looking for a job, you can apply to the Quezon City government. And then we'll have to reconcile also yung national data that we get in terms of clustering. Sa nakikita namin clustering ng mga cases in communities or workplaces, and reconcile that with the list that Quezon City has. Then impose lockdowns. No? Quezon City has specialized local lockdowns kasi, special concern lockdowns in the barangays and then the puroks and then communities in condominiums. So I got a list, I'm getting a list from the national government in terms of the other barangays or clusters that we're seeing. And I've submitted that list to Quezon City and they've committed to take a look also at that list and see if there are more areas that they need to lock down on.
Secretary Karlo Nograles, we need to take a very short break. The Source will be right back. Secretary Nograles, there are various groups pushing for the delay of the opening of classes. In fact, I believe it was also yesterday when Senator Bongo said that he is actually proposing to move it from August 24, which is 10 days from now, to October 20. Ang sabi niya, kung di pa handa, wag nating pilitin. What is the likelihood of this happening?
I think we'll talk about it some more sa IATF meeting po natin. Syempre, yung mga concerns namin is some private schools have already started classes like my kids already have started classes, and many of the people I know, their children have already begun their classes. So if we delay it some more, syempre ang iniiwasan po natin na magiging dehado or behind ang ating mga public elementary and public high school students natin. And it might be more challenging, syempre, from an educational point of view, for them to catch up with the private schools or schools that have already begun. So it's really going to be something that DepEd has to assess and see if they're prepared. I've heard Secretary Liling say that they're already prepared to start classes. And for us, sa IATF, the faster or the sooner we begin classes also, the more chances for us to ensure that kids are in school. And for myself, as Zero Hunger Task Force Chair, the faster also or the sooner we can already begin our school feeding program, then the better also for the nutritional intake of our children, no? Especially in those attending public school. Remember na the law provides that kailangan meron tayong school feeding program for the DepEd school children and DSWD daycare center children. And that has to start soon, no? Because syempre yung nutritional intake and food intake ng mga bata, ng mga undernourished or those we call wasted and severely wasted or stunted children is something that we cannot delay also. No? So those are the factors that we really have to take a look at.
All right. Secretary Karlo Nograles, sir, maraming salamat po sa inyong oras and take care, sir.
Thank you. God bless. Good morning. Maraming salamat, Pinky.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.